Let's talk about how we hand off to the doctor at the doctor exam. This is kind of long, so you're probably going to want to save it for later. Now remember, you've already done all your initial assessments and you've reviewed everything with the patient. That is key. Once the doctor comes in, you let them handle their small talk, interrupt when necessary, and then the actual wording goes something like this. So doctor, Mrs. Carson and I have discussed her medical history. We've talked about the new medication that she's taking and the possible side effect of dry mouth. I've explained what to watch out for, and she said she's going to let us know if she notices any of that. For her gum health, we did not do perio charting today. She was due for x-rays today, and the bone levels look like they did last time. There was increased bleeding in the lower left area, and Mrs. Carson admits to having not been flossing the last couple of weeks because she's been not feeling well. We talked about focusing on that area, and we're going to continue a 6-month recall, and we're going to reevaluate at the next visit. Based on the x-rays and the photos that we took today, it looks like there may be some wear down on the filling on the upper right tooth. I explained that that's a pretty big filling and that there may be some options that you need to discuss with her. Because that tooth has a filling that goes right through the middle of it, we discussed the option of a potential crown. She understands the risks of leaving it until something happens or doing something with it now. Carson mentioned that she'd probably like to get it taken care of because she's going on a cruise and she doesn't want anything to happen while she's away. Otherwise, I didn't notice anything new or changed on the x-rays or photos from last time. At this point, the doctor hasn't even looked in their mouth, but they see the photo and they know exactly what you're talking about. Mrs. Carson is not surprised when the doctor says, gosh, this big filling looks like it's starting to break down. I think you should probably do a crown so that tooth doesn't break. Or reinforce that you don't want the tooth to break while they're on their cruise. The doctor goes in and they either agree and say, yep, let's reevaluate those gums in 6 months. Let's look at that crown on that upper right tooth and we'll get you scheduled. When the doctor leaves the room, you ask the patient again, what questions do you have for me, Mrs. Carson? Probably none. Who wants to see more role-playing like this and scripts like this? Let me know in the comments.